the intersection of being a person of color and having a disability lies the possibility for greater marginalization. Stephanie Douglas braves this road every day, trying to balance care for herself and her scoliosis while being Black.
I feel just me being a Black woman is discriminative. First I'm Black, now and then I'm a woman.
Being mistreated in these spaces leaves a lasting impact and for many becomes a source for their strength. Kanetta Thomas knows exactly what this feels like.
I was called one-armed bandits in school, like in the hallway. That's a casino game, right? I didn't even know what that was at first until I learned. I was like, and it do look like that, because it's only one arm. And I'm like, that is so cruel.
And I have to go back and forth to the hospital, which sometimes I get discriminated against. Like all they want, or all they think that I want, is pain medication.
Everyone wants to feel like they belong, but some face challenges that make them feel like they don't. The NAACP Legal Defense Fund says, people of color with disabilities face significant barriers to healthcare, education, employment, and access to public spaces.
More of my life was judged as far as making it with the disability, with one arm. You're always prejudged by just your appearance before they even know what I can do.
These stories are hard to listen to and even harder to experience. For Thomas, this was a challenge she faced early in life.
I was hit by a car at 1 year old and lost my arm totally. This just totally amputated the arm. The car ran only me over at 1 year old, and so I had to live with that. You're teased, you're tormented, bullied. I wear big coats or big purses on the side and try to camouflage it. So a lot of people didn't notice it because I was like literally flying through life just trying to hide this arm. And so, but those who did notice it, it was either or. Either they liked me or they didn't, tease me or they didn't, but it was definitely hard for me to just love myself. I didn't love myself and was taken advantage of a lot.
A 2012 Annals of Family Medicine study found Black people were 73% more likely to report medical mistrust compared to their white counterparts.
Everything started happening. I started having aches and pains, and that's when my irritable bowel developed.
At times, those meant to care for us can make us feel like outsiders. It's all too common for those who are entrusted with caring for our health to discriminate based on biases they may not even be aware of.
It's like the nurse was so rude because I'm in pain and I couldn't, sit down. When I'm in pain, I have to walk around. But he was so rude, he didn't even give me any pain medication. What he told me that he has other patients to go look after, and he's not going to give me my pain medication.
Medical trauma continues to disproportionately affect people of color, with a Pew Research poll finding that 55% of Black Americans say they've had negative experiences with doctors. Some people will try their hardest to put you down because of how you were born. While we all aspire to be welcomed and appreciated in society, it is equally important to remember love and acceptance come from within and can help you find peace. That's what experts like psychologist Jeff Cohen say. Douglas has her own advice.
Just please don't tease nobody. Please don't tease nobody, because you lowered that person's self-esteem.
First of all, love yourself. First of all, and don't let nobody tell you different about how you feel about yourself, because at the end of the day, it's just going to be you.